Assalamu alaikum, dear doctors. How are you? I am Dr. Azhar again with a new topic for MRCGP South Asia. How to pass this exam in first attempt. Today our topic is benign prostatic hyperplasia. All doctors know that what are the common points of history like family history, long-standing illness, drug history, psychosocial history, and surgical history. But I will briefly explain about specific points of history for benign prostatic hyperplasia. Mostly the patients are more than 60 years of age, but above 50 they can present. And the way presentation, patient will say, I have frequency of urine. At night he wake up to pass urine, or he will say that he pass urine in the washroom, but the stream of the urine is thin. This is the way he present. And what specific points you will ask other than this? You can ask the color of the urine, or directly you can ask, is there any blood in the urine? Do you feel pain in your back passage? Do you feel pain in your testicles? Do you feel pain in your tummy? Do you feel pain in your lower back? Are you feeling weakness of your body? Do you have constipation, or you cannot pass stool regularly? Do you have fever? Do you have joint pains? Do you have any rash on your body? Or few other questions like do you feel that your weight is reduced than before, or do you feel that your clothes are feeling you are feeling your clothes are bigger than your body than before? Do you have any previous history of stones in your water passage or in your kidneys? These are some specific points of history which you will ask to the patient. There is a long list of history points in benign prostatic hyperplasia, but the time will be 10 minutes, so you have to be specific about history. Now, when you come to the conclusion that it is benign prostatic hyperplasia, after eyes and summarization, uh, how you will explain that what disease you have. Now I will tell you. You will ask the patient that do you want to add something in your history? He will say no, or he can add something. Then you will say that, Mr. The disease which you have, uh, I come to the conclusion from your history and examination that your disease is benign prostatic hyperplasia. In medical terminology, we say it benign prostatic hyperplasia. Do you know about this? Of course he will say no, or he can give you report of the ultrasound, or he can give you report of the digital rectal examination of the previous doctor. Then when he will say no, then you will explain what is this disease. There is one gland just below the water pouch. This gland is surrounding the water passage below the water pouch, and in some people, when they become 50 or 60 or 70, this gland started becoming bigger than before, and when it become bigger, it press the water passage below the water pouch. When it press, then patient cannot pass urine properly, or he will have thin stream of water. And when patient go to washroom and pass urine, he feel there is urine, but there is water, but it is not coming out. He exert, or he put more pressure on his lower tummy to pass the urine. Then this gland will press more the water passage, and the stream of the water become more less. This is the explanation. And after explanation, you will ask him, are you with me or are you understanding me? Then he will say yes. Then he can ask you that now what he will do. He is worried about this because it is the big problem for him. He is not going to washroom again and again. Then you will explain that I have some plan for you. uh, One plan is that at home what you will do, please decrease your drinks with caffeine, and please try to reduce water intake or fluid intake in the evening. But when you reduce your water intake or fluid intake, you will be dehydrated, so increase fluid intake in the morning time. In this way, evening decrease in fluid intake, at night he will not wake up again and again. Other, you will tell him that when you go washroom, you pass water, then stand up for few seconds, then again sit, then the prostate gland will relax for some time, and you can pass more water, and you can repeat this 2 to 3 times. And also tell him that avoid constipation, eat more salads, or you can take, if you have constipation, you can take some medicine for this. This is the explanation, or you can tell for home. Plan 2, you will tell him that there are some medicines which can squeeze your prostate gland, and these all medicines you have to take at night, like tamsulosin or alpha blockers, you can say, or 5 alpha reductase inhibitors, which you can prescribe to him. But whenever you prescribe alpha blockers, please explain him about postural hypotension. Don't forget this. And few things which you will ask after the history, or during the history, or in between, that have you ever had blockage of urine before, or blockage of water passage? Have you ever in any hospital somebody pass a tube in your water passage to bring out the urine? This don't forget. Now, after all this, I want to tell you, dear doctors, that please don't forget to ask red flags, which I ask in my history, like lower back pain, fever, and weight loss, and any weakness in the body, and few other questions I asked in my history. Because red flags are very important. Reassurance, which I told you, it is very important. And pamphlets at the end you will give to the patient. And please do safety netting in every case of MRCGP. These four things are very, very important. In this case, safety netting is that if you feel sometimes that urine or water is completely blocked and there is severe pain in your back or in your tummy, please go to nearby emergency department. This is safety netting for this case. And write your own notes. You all doctors are mashallah very genius, and you can write more good things than me. And if you have new ideas, please write in my message me, and in my comments write something. Maybe I will learn from you more. I hope you understand my topic today, benign prostatic hyperplasia. Please listen it carefully, and subscribe my channel, and view it and like it. And next time we will come with a new topic. uh, Please take care of yourself. Goodbye.